If you're over 50, I want you to imagine this for a moment. You're sitting on the couch in your living room. Your ankles are a little more swollen than usual, but you tell yourself, I was probably just on my feet too long today. You've also been more tired lately, getting a bit breathless on the stairs, but you blame it on age or being out of shape. At night you snore so loudly your partner jokes about it. Your gums bleed when you floss, and you think, I really should see the dentist one day. Individually, none of those things seem like an emergency, but together, they could be your heart quietly asking for help long before a heart attack strikes. Hi, this is True Senior Healthness. I work with men and women in their 50 seconds, 60 seconds, 70 seconds and beyond, and I can tell you this. Your heart almost never fails without warning. It sends signals. The problem is that most people either don't recognize them or they brush them off as just getting older. In this video, we're going to walk through 13 often missed warning signs that your heart may be in trouble. Some of them are classic, like chest pain. Others will surprise you like bleeding gums or a stubborn cough. And at the end, we'll talk about 5 powerful, science-backed steps you can take starting today to protect your heart. Before we dive in, one important reminder. This video is for education, not diagnosis. If you ever have sudden chest pain, trouble breathing, fainting, or any severe symptom, call 911 or your local emergency number immediately. And if you have ongoing health conditions or are already on treatment, always talk with your doctor before making changes. Let's start with one that hides in plain sight. 1. Swollen calves and ankles that keep coming back. Almost everyone over 50 has had puffy feet at some point. A hot day, a long flight, a salty meal. That happens. But when swelling in your calves and ankles keeps returning, especially by the end of the day, your heart might be involved. Here's what can be happening inside your body. Your heart is a pump. When it starts to weaken or stiffen, it doesn't move blood as efficiently. Instead of moving smoothly through your circulation, blood can begin to back up in the veins of your legs. That extra pressure pushes fluid out into the surrounding tissues, and your ankles begin to look thicker, your socks leave deeper marks, and your shoes feel tighter. Many people tell themselves, it's just water retention, or I'm standing too much. And sometimes that's true, but if the swelling is there most days, it worsens in the evening, or it shows up along with shortness of breath or fatigue, then it's time to talk to your doctor. This kind of swelling, especially if it's new or progressing, can be an early sign of heart failure or other circulation problems. 2. Bleeding gums and gum disease. It may seem strange to talk about your mouth in a video about your heart, but your gums can tell a powerful story. If you notice, your gums bleed almost every time you brush or floss. Your gums are swollen, tender, or pulling away from your teeth. You've been told you have periodontal gum disease. This doesn't just matter for your smile. Research has shown a strong association between gum disease and heart disease. Chronic inflammation and bacteria from infected gums can move into the bloodstream, contributing to inflammation in blood vessels and the buildup of plaque. This doesn't mean that every person with gum disease will have a heart attack. It means that poor gum health can increase your overall cardiovascular risk, especially when combined with other factors like high blood pressure, smoking, diabetes, or high cholesterol. The good news? Taking care of your gums is something you can control. Brushing twice a day, flossing, using mouthwash if recommended, and seeing your dentist regularly are not just cosmetic habits. They're part of heart prevention too. If your gums bleed often, don't ignore it. Mention it to both your dentist and your doctor. 3. Loud snoring and possible sleep apnea. Now let's talk about snoring. Many couples joke about it. Maybe you even laugh and say, I've always been a loud snorer. But loud chronic snoring, especially when it's broken up by pauses in breathing, choking, or gasping, can be a sign of sleep apnea. Sleep apnea is a condition where you repeatedly stop breathing for short periods during the night. Every time that happens, your oxygen level drops and your body has to work harder to wake you just enough to start breathing again. Your heart feels that stress every single time. Over months and years, untreated sleep apnea can raise your blood pressure, increase your risk of heart rhythm problems, and increase your risk of heart attack, stroke, and heart failure. You might notice that you snore loudly almost every night, wake up gasping or choking, wake up with a dry mouth or morning headaches, feel very sleepy during the day. Even after a full night in bed, If this sounds like you or your partner has complained about your snoring, this is not just an annoyance. It's something to bring up with your doctor. A sleep study and proper treatment, such as a CPAP machine or other options, can protect your heart and give you more energy during the day. 4. Sudden weakness and persistent fatigue. Fatigue is easy to dismiss. You may think, of course I'm tired, I'm getting older, or life is just busy. But there is a big difference between ordinary tiredness and heart-related fatigue. Heart-related fatigue may look like getting unusually winded walking up a small flight of stairs, needing to stop halfway across a parking lot to catch your breath, feeling drained doing chores that used to be easy, feeling exhausted even after a full night's sleep. Your heart's job is to pump oxygen-rich blood to your muscles and organs. If it isn't pumping well, your body simply can't get the oxygen it needs to keep up with your daily activities. In women especially, unusual, persistent fatigue can be one of the earliest and most overlooked signs of heart trouble, sometimes even weeks before a heart attack. If you find yourself saying, "I'm tired" in a way that doesn't make sense, pay attention. Especially if fatigue comes with shortness of breath, chest tightness, dizziness, or swelling, it's time to talk with your doctor. 5. Skin rashes, color changes, or unusual spots. Most of us don't connect skin changes with the heart, but your skin is often the first place poor circulation and low oxygen show up. Some things to notice: a bluish or purplish tint to your lips, fingers, or toes can mean your blood isn't carrying enough oxygen. Red or brown patches on your lower legs can be related to poor circulation. Slow healing sores, especially on the legs and feet, can signal circulation problems. Tiny red or purple spots under the skin, especially appearing suddenly and in clusters, can sometimes be related to blood vessel or infection issues that involve the heart. Of course, many rashes have nothing to do with the heart. Allergies, eczema, and simple skin irritation are common. But when your skin is changing in ways you can't explain, especially if you also have shortness of breath, swelling, or fatigue, your doctor may want to consider your circulation and heart function as part of the picture. 6. Unexplained nausea, indigestion, or upper stomach discomfort. Now let's talk about a symptom that confuses a lot of people: stomach discomfort. Many heart attacks, especially in people over 50 and in women, do not start with dramatic chest pain. Instead, they may begin with a heavy squeezing or burning feeling in the upper stomach, nausea that seems to come out of nowhere, a sensation similar to indigestion or bad heartburn, nausea paired with cold sweats or lightheadedness. Because this doesn't feel like the movie-style heart attack, people often blame it on something they ate or on reflux and waited out at home. Here's the key: if you feel unusual, persistent upper stomach discomfort, especially if you also have shortness of breath, sweating, pain in your jaw, back, arm, or chest, do not just take antacids and hope it will pass. Treat it as a potential heart warning and seek urgent medical evaluation. And if you've been having repeated episodes of unexplained nausea or indigestion over days or weeks, especially with risk factors like high blood pressure, diabetes, high cholesterol, or a history of smoking, talk with your doctor. Your heart may be involved. Before we go on to the next warning signs, let's pause for just a moment. If you're watching this and you're over 50, I want you to know something. It is not too late to protect your heart. Your body is constantly trying to heal and adapt, and small, consistent changes can make a real difference. If you'd like more calm, clear guidance, like this step-by-step explanations, safe exercises, and practical tips made specifically for people in their 50 seconds, 60 seconds, and 70 seconds, consider subscribing to True Senior Healthness. That way, you won't have to sort through advice made for 2 0-year-olds. You'll get information that respects your age, your body, and your goals. All right, let's continue with the rest of the signs. 7. Chronic cough or hoarseness that doesn't make sense. A lingering cough is usually blamed on allergies, a cold, or acid reflux. But sometimes, a stubborn cough, especially a wet, persistent one, can be a sign that your heart isn't pumping properly and that fluid is building up in your lungs. You might notice a cough that's worse when you lie down, needing extra pillows at night to breathe comfortably, coughing up frothy or pink-tinged mucus, a feeling of tightness in the chest, paired with shortness of breath. This kind of cough is sometimes called a cardiac cough. It doesn't mean every cough is a heart problem. But if your cough is lasting weeks, you're short of breath more than usual, or you notice swelling in your legs at the same time, then your doctor may need to check not just your lungs, but also your heart. Hoarseness can sometimes show up as well, especially if fluid or enlarged structures in the chest are pressing around the vocal cords. If your voice changes and stays that way, and you can't explain why, that's also worth mentioning. 8. Fainting spells or feeling like you might pass out. Standing up too fast and feeling a little dizzy once in a while is common, but actually passing out or repeatedly feeling like you're about to is something you should never ignore. Fainting can occur when the heart beats too fast or too slow, the heart rhythm becomes irregular, or the heart cannot pump enough blood to the brain. Sometimes, fainting or near fainting is one of the only early signs of a heart rhythm problem or even a serious event like a heart attack or significant blockage. If you faint without a clear reason, feel your heart racing, fluttering, or skipping beats before you get dizzy, or experience fainting along with chest pain or shortness of breath, this is a reason to seek medical help right away. Even a single unexplained fainting episode should be discussed with your doctor, especially after age 50. 9. Sudden excessive sweating, especially cold sweat. Breaking a sweat when you're walking briskly, exercising, or on a hot day is completely normal. What's concerning is sudden, heavy sweating for no obvious reason, especially if the sweat feels cold and clammy. Your body's nervous system may trigger this kind of sweating when the heart is under severe stress. Many people who have had heart attacks describe a cold sweat that suddenly appears, sweat soaking through their clothes while they're at rest, sweating accompanied by nausea, dizziness, or chest discomfort. If you are sitting calmly, not overheated, and your body suddenly breaks out into a cold sweat, especially if you feel pressure in your chest, tightness in your jaw, pain in your arm, or trouble catching your breath, this is an emergency warning. Do not wait to see if it passes. Call 911. Even outside of emergencies, persistent, unexplained night sweats, particularly in women, can sometimes be one of the more subtle signs that the heart and circulation are under strain and deserve a closer look. 10. Anxiety-like episodes that don't fit your usual pattern. Anxiety and panic attacks are very real and very common. But sometimes what feels like just anxiety is actually your heart struggling. A heart-related episode can look like sudden feelings of doom or panic, a racing or pounding heart, chest discomfort or pressure, shortness of breath and dizziness, cold sweats. The confusing part is that this looks almost identical to a panic attack. One clue is context. Panic attacks are often linked to a clear trigger: stress, conflict, crowded spaces, especially if you've had anxiety for many years. Heart-related symptoms, however, may appear suddenly without an obvious emotional trigger, occur more often with physical effort, come along with other signs like swelling, fatigue, or reduced ability to exercise. If you've never had anxiety in your life, and in your 50 seconds or 60 seconds you suddenly develop panic attacks, it's important to rule out heart and circulation problems as part of your evaluation. Mental health and heart health are deeply connected, and both deserve attention. 11. Difficulty exercising or climbing stairs. One of the earliest and most important warning signs is simply this: things I used to do easily now leave me short of breath. If you notice that, climbing a single flight of stairs makes you stop and catch your breath, walking across the grocery store feels like a workout, you avoid hills or inclines because they feel too hard, you feel tightness in your chest or throat when you walk quickly, do not just chalk it up to getting old. Yes, aging changes our capacity, but a sudden or progressive drop in how much activity you can tolerate can mean your heart is not keeping up with your body's needs. It may be struggling to pump blood forward, or fluid may be beginning to build up in your lungs. If your exercise tolerance has clearly worsened over weeks or months, especially combined with fatigue, swelling, or chest discomfort, that is a clear reason to see your doctor for a heart check. 12. Cold hands and feet all the time. Almost everyone has cold hands or feet in winter. That's natural. What's more concerning is when your hands and feet feel cold or numb most of the time, even in warm rooms, even when the rest of your body feels fine. This can be a sign of poor circulation, sometimes due to narrowed arteries that are not allowing enough blood to reach your extremities. Over time, reduced blood flow can be related to the same processes that cause coronary artery disease and heart attacks. You might notice your fingers and toes look pale or bluish. You frequently have pins and needles, sensations. Your hands and feet feel icy, while your torso feels warm. Small wounds on your feet take a long time to heal. Cold extremities can have several causes, not only heart disease, but they're a signal that your circulation needs evaluation. It's especially important if you have other risk factors like diabetes, high cholesterol, smoking history, or high blood pressure. 13. Chest pain or pressure, when to worry. Finally, let's talk about the symptom that everyone knows, yet still often misunderstands: chest pain. Chest pain from the heart is often described as pressure, squeezing, fullness, or tightness in the center or left side of the chest, a feeling like an elephant sitting on my chest. Discomfort that may spread to the arm, neck, jaw, back, or upper stomach, sometimes paired with shortness of breath, nausea, or cold sweat. It may come on suddenly. It may build gradually. It may start when you are walking, climbing stairs, or stressed and ease when you rest. It might be mild at first and then worsen. Here's the important rule. If you have new, unexplained chest pain or pressure, especially if it lasts more than a few minutes or goes away and comes back, treat it as an emergency and call 911. Do not drive yourself to the hospital. Do not wait to see if it goes away completely. The sooner a heart attack is treated, the more heart muscle can be saved. Chest discomfort can also be caused by heartburn, muscle strain, or anxiety. But it's not your job to sort that out at home. It's your job to get evaluated quickly and safely. Let the medical team figure out what's causing it. 5 proven ways to protect your heart after 50. Now that we've covered 13 warning signs, I want to leave you with hope, not fear. You cannot control everything about your heart. Genes, age, and past habits do play a role. But even in your 50 seconds, 60 seconds, 70 seconds, and beyond, there is a lot you can do. Here are 5 powerful science-backed steps you can start discussing with your doctor. 1. Know your numbers. Ask your healthcare provider about your blood pressure, cholesterol levels, blood sugar, or A1C, especially if you have diabetes or prediabetes, weight and waist circumference. These numbers are not about judgment, they're signposts. When you know them, you and your doctor can make a clear plan to lower your risk. 2. Move your body gently but consistently. You don't need to run marathons. For most seniors, regular, moderate movement is far more important than intense workouts. Aim for activities like comfortable paced walking, gentle cycling on a stationary bike, water aerobics, simple strength exercises using your own body weight or light bands, balance and flexibility work. If you have not exercised in a long time or have medical conditions, talk with your doctor before starting. Ask if a cardiac rehab style program or supervised exercise might be right for you. The goal is safe, sustainable movement, not pushing to exhaustion. 3. Eat in a heart-friendly way that fits your life. Think less about strict dieting and more about patterns. Many heart specialists recommend a style similar to a Mediterranean pattern. Plenty of vegetables, fruits, beans, whole grains, nuts, olive oil, fish, and modest portions of lean proteins. You don't have to change everything overnight. Start small. Add 1 extra serving of vegetables each day. Swap sugary drinks for water most of the time. Include heart-friendly foods like oats, berries, and a bit of garlic in your meals if your doctor approves. If you already have kidney disease, diabetes, or other conditions, ask your doctor or a dietitian which version of heart-healthy eating is safest for you. 4. Protect your sleep and treat snoring seriously. Good sleep is not a luxury, it's a pillar of heart health. Aim, if possible, for 7-9 hours of sleep most nights. If you snore loudly, gasp for air at night, or feel excessively sleepy during the day, talk to your doctor about screening for sleep apnea. Treating sleep apnea can lower blood pressure, improve energy, and support your heart. 5. Take care of your mouth as part of taking care of your heart. Brush at least twice a day, floss daily if you're able, and see your dentist regularly. If your gums bleed often, recede, or are painful, don't ignore it. Tell your dentist and your doctor. Treating gum disease doesn't just protect your teeth, it may reduce inflammation throughout your body and support your cardiovascular health. A gentle closing reminder. Your heart has been with you through every joy, every stress, every milestone of your life. It has worked day and night without ever taking a vacation. The least we can do now, in our 50 seconds, 60 seconds, and 70 seconds, is to listen when it whispers before it has to scream. If you've recognized yourself in any of the symptoms we've talked about today, swollen ankles, stubborn fatigue, strange indigestion, heavy sweating, snoring, gum problems, or chest discomfort, please don't panic, but don't ignore them either. Make an appointment with your healthcare provider. Let them know exactly what you're experiencing and how long it's been going on. And if you ever have sudden, severe symptoms like chest pain, trouble breathing, or fainting, call 911 without delay. It is always better to be checked and told it's not your heart than to stay home and risk a serious event. Remember, nothing in this video replaces advice from your personal doctor. If you live with conditions like diabetes, high blood pressure, kidney disease, or previous heart problems, your situation is unique. Always discuss changes in your symptoms, medications, exercise, or diet with your healthcare team first. Your heart has carried you this far. With awareness, timely medical care, and gentle lifestyle changes, you can give it the support it deserves so you can stay independent, active, and present with the people you love. If this helped you understand your body a little better today, take a moment to be kind to yourself. You're not behind. You're simply becoming more aware, and that awareness can be life-saving.